Hello, good afternoon. My name is Darian Jones. I'm the Caregiver Education and Digital Specialist at Care Partners. Thank you so much for joining us today. We're going to be talking about the coronavirus today and just different ways to keep yourself healthy, safe, and just kind of knowing about some of the different resources that are available. So it's going to be a really interesting topic today. We have a really special guest, so we'll be getting into that in just a moment. Before that, I wanted to let you guys know that because of the coronavirus, we are continuing to suspend all of our in-person programming. Our number one goal at Care Partners is, of course, to keep everyone safe and at the same time still being able to provide hopeful education, support, and resources. And that's our whole goal with some of these hot topic segments and all the other things that we're doing at Care Partners is to just help keep you connected and help keep your loved one engaged and just provide you guys with some fun things to do while you're at home. So if you do want some more information about all of the other resources we're providing, you can visit the Care Partners Texas website. We have a whole monitoring the coronavirus page, and all of our program updates are on there, but you can also check out the Common Ground support group page, as well as the Gathering Place page. We're updating that every single week with different activities and guides that you can download and do at home. So there's a ton of different things for you to check out. And then we'd also love to hear from you. So the whole thing is we're a little bit more away from each other, but we still want to stay as connected as we can. And so if you have any fun stories or pictures or anything, we would love to hear from you and hear about them. And you can email us anytime at info@carepartnerstexas.org. We would really love to hear from you guys, and we want to know that we're still here we want you to know that we're still here for you. And with that, I think we're going to go ahead and get started with the topic today. So I'm going to introduce our guest. Let me pull it up. Hi, how are you doing today, Ms. Jessica?
Hello.
This
Hi.
is Dr. Jessica Berry from Memorial Hermann, and she's going to be talking to us about different ways to stay safe and healthy. So do you want to tell us a little bit about yourself and some of your background?
Sure. Hi, I'm Dr. Berry. I work at Memorial Hermann, the Woodlands. I've been practicing for over 5 years. Recently moved to Houston, which I love working for Memorial Hermann so far. And I'm glad all of you can make it to this podcast. And I hope that you have a lot of knowledge. And if you have any questions, please feel free to reach out.
Yes, again, I just want to reiterate that too. Anyone at home watching, you all can comment at any time with your questions, and we'll be sure to get to that either during or at the end. I'll make sure to cover all the questions. So I think with that, we can go ahead and get into the topic today. So I'll just hand it over to you.
Sounds good. Thank you. So I kind of wanted to go over the discussion to kind of start off with what is COVID-19? How is it mainly spread? And I think a lot of people already know it is a virus, similar to the flu, similar to a lot of the other viruses out there. This one has seemed to hit us a lot harder than the other viruses have, including the flu back in the day and everything. So one of the main things that I think people should know or even be vigilant about knowing is how the virus is spread. And that kind of goes into keeping safe with the Corona-19 virus that's going out. So the main way that the virus is spread is actually by droplets. A lot of people have heard airborne and all these other things, but it's actually the secretions that come out of your mouth and even your nose that actually spreads the virus. The way that they have these to stay 6 feet apart is because they look at how far those particles travel whenever you sneeze or when you cough. So those are the main things that we're trying to prevent with the entire COVID-19 preventative treatment and preventative methods that we're doing. So one of the first things I would like to go over is something that almost everyone is abreast to, which is wearing the mask. So I actually have a few masks here because one of the biggest things I get asked a lot by people, even patients and everything is, how do I know which is the right kind of mask? I know they say to cover your nose and cover your mouth, but is that enough? So as you know, we have our wonderful surgical mask. This is the one that most people think and deem to be worthy. And all you do is, of course, put it around your ears. And it actually covers the nose and it covers the mouth. These are great to wear. And of course, you're supposed to be wearing them anytime you're outside of the house, anytime you'll be moving around, even if you have people in your home. I say the best way to do is to stay protected. A lot of people have also been doing the made at home mask. Someone actually gave this one to me in the hospital. And there's nothing wrong with making your own mask. Be very careful. Make sure it is a mask that can be washed or at least cleaned or changed out. You don't want to keep wearing the same mask every single day for 2 or 3 weeks with not ever washing it. One, you still have the outside, which particles can accumulate from the saliva and everything else from the environment. So you want to make sure you do have a mask that's washable. A lot of people have been asking me the difference between the surgical mask, which is that normal one that you wear. And here are some examples of N95 mask. This is the one that we wear in the hospital. This is one that my husband actually wears at work, that he's required to wear. So as far as being in the general population and the public, there's nothing wrong with just wearing a surgical mask or one of these wonderful handmade masks, as long as it covers your nose and your mouth. The thing I see a lot with people is when you wear your mask, a lot of you will do this. So you can breathe better. And of course, these masks are very hard to breathe. But if you expose your nose, one of the main things is you are susceptible to getting the virus as well as spreading it if you are infected. So whether you have a cloth, an N95, any of these masks, your nose needs to be completely covered at all times. I know it's very difficult, but it's something that needs to be done. So these are the masks. And the other one that I've seen a lot of people wearing is, I am so sorry. This is one of the masks that's produced, and it does have these little button things on it. Be very careful because some of these will actually have a filter inside. And as you can see, if the filter is removed, it's actually full of holes that you can actually see through. If your mask has any type of holes that you can see through or anything like that, it is not doing its job. So make sure all of your masks have adequate covering, no holes. Make sure it's a material that will actually block the spread of the virus. The next thing I'd like to go into, I know a lot of people have asked me in passing by, is should I wear a shield? And these shields are kind of, if you can find one, they're almost very difficult to find. But if you have one, they're good. The reason is because it actually stops the secretions, of course, from the eyes and the nose. These are not mandatory. They are not CDC approved or anything like that. If you have one, that's amazing. Still wear your mask, your surgical mask underneath it if you are going to choose to wear a shield. Just because it does stop the particles, but it doesn't prevent you from spreading the particles as well. So that's one of the things. If you have one, it's great. If you don't worry about running to the store trying to find one. The next thing that I would like to talk about is these wonderful gloves. A lot of people, whenever you go out in public, will see other people wearing these wonderful gloves. Gloves are great if you use them correctly. So the problem with the gloves that I see a lot of people doing, and this is just a little demonstration that I actually saw one of the nurses on one of the shows do this demonstration, and it really hit home because I've seen a lot of people walking around. They have their face masks on, they have their gloves, they're doing a great job trying to be protected. I'm going to put my mask on because this is the way we see people going to the mall a lot or going to the grocery store. And the thing is, wearing gloves does protect your hands, but if you're not using them correctly, it can spread germs. I'll give you a quick demonstration. Let's say I'm in the grocery store. I put my gloves on, my mask is on. My hands are 100% clean. I go to the grocery cart that hasn't been cleaned yet, and they have little wipes there. So I touch the grocery cart, or you touch the door getting in, and let's say this on my hands is the touching all the germs that I actually received. So it's kind of a visual display of what you would see. So then you're on your grocery cart doing that. And then let's say your mask is sliding down and you can't breathe. So then you touch your mask and readjust it. And now, as you can see, all the germs that were on that cart are now on the outside of your mask. And let's say your face itches. So let's say I scratch my face. Now I put the mask back on. So now, as you can tell, the germs are on my face, they're on the mask. And let's say I pick up a bottle of something else in the store. I open another door or something, and then I pick up my cell phone and I'm texting my husband. And then I'm like, oh, he's calling me, let me answer. And then you put your phone to your ear. And then as you can see, all of the germs, but my hands are still clean. But as you can tell, we're spreading these germs everywhere. So be very vigilant if you have gloves on. They do not protect against the spread of the virus if you do not use them correctly. The correct way is don't touch anything. Don't take your phone in the store. If you do, put it in a plastic baggie. Before you leave, take it out of the baggie after you've taken your gloves off. Don't touch your mask once your mask is on your face. Don't itch, don't scratch. If you have to, use another part of your body that is not going to be exposed to different antigens and different surfaces. Okay, so that's one of the main things I would like to stress is I see people wearing gloves all the time, but they touch and manipulate everything, and then you're just spreading it and you don't even realize it. People come to the hospital saying, I did everything right. I wore gloves, I wore my mask every time I went outside. But as you can see, it still doesn't protect you if you're not doing it correctly. So the next thing I'd like to touch on is cleaning. One of the main things with cleaning would be, of course, using bleach and using alcohol. Here I have my little jars. Make sure. A lot of people have told me we can't find Clorox anywhere. We can't find this anywhere. It's okay to make your own. You can make your own at home. If you have any type of bleach, put it in a spray bottle, use a paper towel or anything else, moisten it with the bleach, and just make sure it's in the right concentration. Sorry, I'm just gonna wipe this off really quickly. All of my germs that I've spread. And that was just some facial cream that I used, non-toxic. So that's one thing. And make sure if you do put your bleach in a bottle or your alcohol in a spray bottle, make sure you label it. And it's so easy just to even spray your hands if this is alcohol, not with bleach, but with the alcohol. And of course, we always like our Germ-X with any of our hand sanitizers, keep them around the house. If you enter or leave the house, try to sanitize, try to carry some with you. The more you can use alcohol, the more you can keep yourself clean, it's going to be the best. And of course, the biggest take-home message is to stay home. The reason being is you don't have a lot of foot traffic. The more foot traffic you have, the more chances you have to spread the virus. And on the point of spreading the virus, in the hospital, we've seen so many younger patients that are coming down with coronavirus that never knew that they had it. And for them, that's not a big thing. But the problem is if they don't have the symptoms, they're not sneezing, they're not coughing, there's no fever, then they don't know who to stay away from. So they go and they visit grandmother who ends up getting the coronavirus and is in the hospital, and she doesn't know where she got it from. So just because you don't have symptoms, just because you don't have a temperature, just because you're not coughing, does not mean you are not infected with the virus. Some people infected will not have symptoms. You might have a runny nose or something very mild for just a short amount of time period, but you still can pass it to another person who is more at odds with actually getting the disease. Wherever it manifests itself. So wearing a face cover doesn't only protect you, it protects everyone else because you might not know that you have the virus. You might feel great, nothing wrong with you. But if you wear a facial covering, you are not spreading it to other people. So the thing is, even if you feel well, you need to wear a face covering. The last thing I'd like to go over with the stay at home is a lot of people rushed out to get thermometers and everything whenever that happened, it first outbroke. So we look at the temperature as a marker of, are you have a fever? Is there any type of inflammatory response? One, having a fever does not mean you have COVID-19, but it can mean you probably need to get tested just to make sure. In your home, excuse me, in your home, it is a good practice to test your guests before you actually have anybody come to your house. Of course, we want to limit the amount of people to less than 10. That's kind of our regulations right now. And the reason being, like I said, the more foot traffic you have, the more people you have around you. the more people, it could be children, it could be people who don't even know they have symptoms, who spread it to the rest of the guests. And you will never know until the one person who is susceptible to having symptoms gets tested as positive. So it is a good practice to take temperature of people who come into your home or do anything in a mass group, less than 10 people. But at the same time, if a person does not have a fever, it does not mean that they do not have the virus. So just because you're testing people and everybody's negative does not mean somebody is not going to be a carrier. And with that, I'll open it up for questions. If anyone has anything that they'd like to get off their chest, or any stories or anything for me.
We have, excuse me, our president, Jen Adair, says, thank you so much, Dr. Berry. It was a great topic and some great reminders. And I wanted to definitely agree with that. I loved your visual of how the masks work and how you can still transfer germs even if you're protecting your hands. So I really love that. And I think that's a great reminder. So I guess, let's say, because I think of it as kind of different phases. You're healthy, and then there's the phase where you may have been exposed, and then there's the phase where you know that you're sick. So let's say you're in the first phase or whatnot, and you think or you know that you're healthy and the people around you are healthy, and you kind of touched on that a lot. But what would, I guess, your main tip be for protection?
Well, the main thing is for everyone to act as if they're a carrier. That is 100% the easiest way to go about it. Everyone should act as if they have the virus and they can carry it and expose it to other people, whether you have symptoms, whether you don't. If everyone does that and everyone acts as if they have the virus and they're a carrier of it, there would be no spread, because those people would isolate, which would be everyone. They would wear their protective gear. They would stay away from other people. Which is the main way. Whenever we have the other viruses, such as the influenza, it is not as contagious. This one, you can get it with being within 6 feet of a carrier. And that's, of course, why we have our 6-foot rule. But if everyone just assumes that they are a carrier, even if you are a healthy 20-year-old who goes jogging 3 miles every day, still act as if you're a carrier and can infect other people. And I feel like that's the only way we're going to get past this, is for everyone to do that.
Some great advice. And we do have another question from Jenna. She says, has the period of isolation, if you're exposed, changed? And if you were diagnosed with it, how long do you have to stay put? And then we'll come back to him too, but we'll just read this out loud. What are some of the things you'd recommend to build an immune system?
So one of the main things for the period of isolation, I don't think it should end until the virus is on a hard down slope. Every time we get on a down slope, everyone eases up on their isolation. And the problem with easing up on the isolation is that's when we begin to spread it again. And this virus is actually mutating. It's having different forms. Different forms are more virulent than other forms. They affect us more frequently. And so with us lightening up on the isolation, it still needs to be with a grain of salt. It needs to have protection. And I think with everyone wearing a mask, you decrease the odds of spreading it. So then isolation can be eased up on. But we need to make sure we stay vigilant. Otherwise, our numbers are not going to get where they need to be, and we'll be living with hibernation until it's gone. So if everyone can just do this for a small time period, which by small, it's already been 3 months, but we haven't had 3 or 4 months with a constant, everyone wearing masks, everyone making sure their hands are sanitized, making sure all the carts in the grocery store are sanitized. Once we start doing that and we make a pattern of it, that's when we're going to see easing of the isolation orders. The next question, of course, is the diagnosis. How long do you need to quarantine? Quarantine is different than the whole stay-at-home order. Quarantine means you are infected, you need to stay away, you have a very high risk of transmitting it. And with the quarantine, it's 14 days as of now. Those are the current guidelines from when you first had symptoms. If you have been in the hospital and have been told by a physician to quarantine for a certain date, those guidelines need to be followed. But not everybody with the coronavirus, including those who go to the outpatient offices and are tested, need to be in the hospital. So if you are diagnosed with it, we say 14 days from the onset of symptoms. Of course, if your symptoms continue after the 14 days, we always put it with the air of caution, even though we have seen some of the symptoms go for months, even though they're not actively infected. But on the flip side, we have seen patients who are actively infected have done 14 days and continue to test positive, which means they are still a carrier of the disease. So at this point, coronavirus is still very new. We're still learning a lot about it. And I feel like the more we learn about it, the more complicated it gets. And like I said, we have patients who continually test positive after months, and then we have patients after 14 days who test negative. So as of now, the guidelines is 14 days after symptoms. But if you start having fevers again, if you start having the same symptoms that you are having, you should get retested. And we say not to get retested within 14 days of the original positive test. So if you do need to be retested, you may, but only if the symptoms don't get better or get worse, or you start having those fevers and all your other symptoms again.
That's great. Some great clarification there and some kind of explaining what all the different terms mean, because I know it can be a lot sometimes, but very helpful as well. And I think her last part of that question was, do you have any recommendations to help build your immune system?
Okay, so it'd be a lot of the kind of verbatim what a lot of people have heard. A lot of antioxidants are good. A lot of fruits and vegetables have great antioxidants in them. Another one is, with a grain of salt, of course, vitamin C. I know a lot of people have been kind of taking the emergency, and of course, there are certain limits to the amount of vitamin C that you do need. But just staying healthy in general, keeping your body healthy, because we have seen with the COVID-19, it's bodies and people who have pre-existing conditions. So if you know you have heart failure, if you know you have high blood pressure, or if you know you have diabetes, try your best to keep those within their boundaries, whatever your medical guidelines were for those. If you have diabetes, try your best to manage it the best you can. If you have high blood pressure, check your blood pressure more often. Try to make it streamlined so you are not one of those predisposed people. And that's kind of the only way we can really do this, is to keep yourself healthy with just those kind of everyday modalities.
That's some great advice too. Definitely keeping yourself healthy and just trying to stay as in shape as possible. I know, at least for me, being active too can help.
Yes, especially while you're at home. Staying active has been more difficult. One, I don't think a lot of us went to the gym anyway, but now it's kind of forcing us to do a lot more activity at home. Which I always tell people, don't sit at home all day, even if you're working from home. There are certain things, because being at home, being sedentary is one of the things that can increase your predisposition for getting any type of illness. So get motivated, walk up and down the street. I've seen a lot of people walking. Of course, stay 6 feet away from all of the other individuals. If you have access to a pool, swimming is great. Even taking a little jog. I saw a lady up and down the driveway. That's all she would do. I see her every day. She goes up and down her driveway doing a few laps. Just things of that nature you can do around the house. Even cleaning as an activity. Maybe it's time to do that deep clean. And I'm pretty sure a lot of our homes probably could use a deep cleaning, and it gets you a little winded. So just little things like that should really help you kind of stay in shape and keep your metabolism and everything else up, which of course helps fight any type of virus or any type of illness.
Yeah, I was going to say with the cleaning, that's a great idea. For me, I need to do that. But anyway, I guess we'll try and wrap it up real soon. We'll leave it with one last question. So let's say that someone in your family does test positive. What are some safety precautions or things that you could do to help during that time?
Okay, so that's actually a very common question I get, especially from my patients who are discharged. So I'm so sorry.
I have my cats that like to jump in the background sometimes. So the pets are just a fun little part of this experience.
So for family members, the first thing we say is isolate them. If you have the ability, we say to either put them in a room by themselves that has its own bathroom. A lot of people don't have that capability to have a family member have their own room with their own bathroom, but that's preferred. With that preferred method, whenever you're transporting food or anything of that, we say to, kind of like the delivery people do, you put a tray like on the floor outside the door. Later, after you've left, they open the door and will get the tray. And that's how we kind of do it. Once the tray is being redelivered, you should have gloves. put the tray, wash all the whatever you do, the dishes, then take the gloves off, with kind of trying to be as clean as possible. If you do not have the ability to do that, we say to try to isolate them to the best of your ability. If they're using the same restroom as the family members, make sure you Lysol, clean it, have a time period where they use the bathroom, clean it all, and then, of course, have them go back into isolation. Kind of after they've used it, make sure they're not kind of in and out too much, because that's a way of spreading the virus. And I know it's very difficult for family members who the mom or the dad is ill and they have young children at home. But it's one of those we really say try to stay your distance, no hugging, nothing like that, because we don't want you to be within any type of distance where you can give anybody else in the family any of those disease or any of those symptoms that you're having, including being positive for the COVID-19.
Well, I think we're going to wrap it up with that. We really appreciate you taking the time to be here and answering all of our questions. We hope everyone at home had their questions answered, and hopefully you guys learned, or everyone at home learned something too. And I think with that, we're going to say goodbye and have a great rest of your week. We'll be back soon with some more educational hot topics. And if you ever missed any, you can visit our website. There's a whole list of videos and resources that you can find. Thank you again, Dr. Berry. We're so grateful that you were able to come here and share with us. So yeah, just have a great day, everyone. And thank you so much.
Okay.